Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visa liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Pigmentary disorders or hyperpigmentation in most cases is common issues that I do see and face when patients come in to consult us. There are many causes, many underlying different conditions when patients telling us that they have pigmentation issues. So it can be congenital, which means you are born with it, like moles, Mongolian spots, cafe au lait pigmentations, or acquired, like freckles, melasma, or what we call sunspots, or post-injury hyperpigmentation. The first thing patients complain when they come in for pigmentary issue is that we need to investigate and we need to speak to them and understand the condition and causes to make a proper diagnosis, because the treatment is different. And the prognosis, the response to treatment is different for different conditions as well. Once we are able to get this correct, then patient will have a reasonable expectation of what the outcome will be like, and they will not be frustrated if the response is imperfect or a bit too slow. In general, acquired pigmentation are usually caused by like your body's hormonal issues, skin types, response to drugs, medical conditions, and most commonly, most importantly, is ultraviolet or sun exposure. All these things will affect your pigmentary conditions, making it worse depending on the type of issues that you are dealing with. So the common pigmentary conditions that we do face in our clinic are like age spots, freckles, melasma, and post-inflammatory hyperpigmentation. These are the few very common acquired pigmentary issues. Causes are different. So as you realize that the factors that you can affect are things that you can change. Things that you cannot change is your hormonal fluctuations, your skin types, and genetics. So things that you can change is the exposure to drugs, your medical conditions, and UV sunlight exposure. Taking care of your skin from sun exposure, good skin care, sunblock, manage your health condition, and make sure that the interaction between the medicine drugs that you're taking doesn't lead to a cause worsen your condition. So we'll discuss this quite in detail with these patients as a start, as to manage their pigmentary condition. Without this being managed well, subsequent treatments may not achieve the desired results. Once we have done that, then we are looking at what else we can do for the patients to improve the condition. So in broadly speaking, there are treatments which are non-invasive and invasive as well. The non-invasive treatments involves skincare, oral supplements. These are types, skincare oral supplements are meant to reduce, to manage, or sometimes even to improve the pigmentary conditions. Like for example, the usage of medications such as hydroquinone, tretinoin, vitamin, antioxidants, tranexamic acids. These are things that we can use as a skincare supplement or oral supplement. So we usually manage patients by discussing with them the needs and the effect and complication side effects of treatments. We usually start with the use of skincare supplements, oral supplements. Examples are hydroquinone, tretinoin, tranexamic acid, so on and so forth. These are the various substances that are useful for different types of pigmentary conditions. And you also often hear about many other aesthetic treatments, such as facial peel, laser, radiofrequency, microneedling, and so on and so forth. So what are those? Those are different minimally invasive treatments that often doctors use to treat various conditions. For example, chemical peel is a type of facial acid that doctors apply on the skin to do what we call light exfoliation, is to remove superficial layers of tissue, dead skin from the face and allowing rejuvenated cells to surface and kind of like improve surface texture, improve scars, and to a certain extent, improve pigmentation as well. A laser treatment is another very effective tool for doctors to use. There are many types of laser, such as pigmentary laser, resurfacing laser, there are vascular laser, and so on and so forth. For pigmentary conditions, doctors usually use combinations of treatments such as picosecond lasers and Nd:YAG lasers, sometimes even combination of vascular lasers and such and such. If used correctly and if it's combined effectively, treatments are usually very encouraging for most patients. However, certain conditions such as melasma can be pretty stubborn. Melasma is one of those stubborn skin pigmentary conditions that doctors and patients often having nightmares and headaches. Different treatment protocols and combinations are required from patients with different types of responses and different types of melasma. And it often requires doctors and patients to discuss and come up with a more detailed and tailored program for the patients. And the next issue that I would like to put some attention to is what we call PIH, or post-inflammatory hyperpigmentation. As the name suggests, it's due to pigmentation from an injury. It could be from a cut or a surgery, or from a laser treatment with the skin injured or burned from the treatment, which subsequently may lead to increased pigmentation rather than an improved skin condition. So the paradox is patients who develop PIH may end up with more pigmentation after laser treatment compared to before. And you often frustrate the patients because this is what they are looking for. Unfortunately, for Asian patients, there's higher risk of PIH compared to like a Caucasian with a lighter skin type. We are usually advise the patient properly when we use certain treatments, telling them about the risk of PIH ever develops, what the treatment and management that we can provide them. Fortunately, PIH for most are not permanent, which means that they usually resolve over a period of time. It could be months, and hence it's very, very important to counsel and advise them properly. After laser treatment, after microneedling, so on and so forth, you may have some redness, some swelling, some inflammation. So aftercare is equally important in taking care of the wound, in applying certain masks, serum, and of course certain sunblock as well. And there are certain products that may cause irritation. It could be too oily and too greasy. So you should actually discuss with a doctor, come up with a tailored combination to make sure it suits you best. We can take all these into considerations. As you can see, that treating pigmentation issues is rather complicated. There is no one size fit all or one treatment that fits all patients. Very often, the doctors have to discuss with you the treatment options and then, of course, your expectation and budget and so on and so forth. So it's something that, to me, pigmentary treatment, it's more of developing a trusting relationship between you and a doctor, and to be patient to see out the results, and of course to raise any issues that you face along the way. There are a few new treatments for the past number of years that is rather exciting and useful for us to use. One of them is what we call a picosecond laser. Essentially, it's a newer laser treatment for pigmentation. For us, I think it suits best Asian skin with higher risk of PIH because, as why I mentioned earlier on, picosecond laser allows us to have lower risk of hyperpigmentation PIH issues. And in some cases, it has more high efficacy and better results. Next thing I want to talk about is what we call radiofrequency microneedling. Radiofrequency microneedling, it's a very, very interesting concept, especially for the last number of years, for us to treat minor scars, certain pigmentation, and for skin rejuvenation as well. It allows us to kind of deliver certain amount of radiofrequency tissue with microneedling into your skin, often a few millimeters in depth, to induce or perform changes and improvements. And sometimes we couple with erbium glass laser to help tightening as well. So a combination of all these treatments nowadays allow us to cater to patients with different needs and different conditions and deliver predictable results for them. Thank you for listening. If you have any questions, just email us. See you again.